Dr. Howard Routman is an orthopedic surgeon with Atlantis Orthopedics in West Palm Beach, Florida.
A lot of people don't think about the shoulder as much as they do their other body parts, particularly because we don't walk on our arms. So what can you do now that you couldn't do before?
I can pick up a bucket and carry it if we're doing gardening.
The shoulder is the most mobile joint in the whole human body, and as a result of this mobility, it also has a high rate of instability. And in order for the shoulder to remain stable, the muscles around the shoulder joint have to help compress the ball into the socket to keep it from slipping and sliding in the wrong directions. And those muscles are things like the rotator cuff. The shoulder joint is made up of the humerus bone, which is the top of the arm bone, and it couples with the socket that's part of the shoulder blade. The ball is on top of the humerus bone, and the socket's part of the shoulder blade. It's a ball and socket, but not like other ball and sockets we have in the body. For example, the hip, the ball sits inside of the socket, so the ball is smaller than the socket. The shoulder, on the other hand, the ball is larger than the socket, so it sits on it like a golf ball on a golf tee, and the surrounding musculature is responsible for keeping the ball stable on that socket. Can you put it on top of the head? So when people have things go wrong with their shoulder, it's usually the rotator cuff, if it's muscles and tendons, but if it has something to do with the joint itself, it can be arthritis of the shoulder where the cartilage wears out.
Although anyone can experience shoulder pain and damage, it is more commonly seen in older people. Shoulder replacement surgery is an option only when all non-surgical treatments have been considered and/or tried. If these treatments fail and the patient's quality of life is being affected on a regular basis, then surgery may be considered.
Candidates for shoulder replacement surgery are patients who have an arthritic shoulder, who are healthy enough to withstand the anesthesia and the stress to their system that the operation provides.
Beth had to undergo a reverse shoulder replacement because of her damaged rotator cuff.
Immediately after the surgery, my arm was swollen, and that took a little time to get down. And once that was down enough, I started the physical therapy, and I worked with the bands, with the weights, light weights, and got to a point where I could like put my arm up here, and then now I can go all the way up, which took quite a bit of work, and then reaching to the back.
Beth is now 2 years post-surgery and is doing great.
I think it's pretty much back to where it used to be. I pretty much do everything I need to do. I love to paint. I'm painting a portrait of 2 of my grandchildren.
The most common thing that patients said about their shoulder replacement is, "I wish I wouldn't have waited as long," because it's a problem that can really be not life-threatening, but quality of life threatening. So if you're having pain in your shoulder and you're not really sure what it is, or you think it's arthritis, or you think it could be one thing or another, get in and see a shoulder doctor.